Hello.
Hello, hello. It looks like it's time to get started.
All right. Well, my name is Dr. Danielle Williams, and I have with us Dr. Olympia. I want to first just let Dr. Olympia introduce herself and her knowledge and base before we get started, and then I'll introduce myself and my experiences. Dr. Olympia?
Good evening, good afternoon, everybody, depending on what your time zone is. My name is Dr. Olympia O'Neill White. Sometimes I go by Dr. O. I am the owner and founder of Through My Lens Consulting Services. It is an organization focused on supporting human service professionals and influencing the next generation of professionals through education, support, and a lot of public speaking engagements, something like this. I am a clinical social worker. I specialize in trauma, perinatal mental health, and those experiences. So I'm glad to be here. I'm excited to be here, and I appreciate the time.
All right. Well, thank you very much. My name is Dr. Danielle, and I am a pharmacist full time. I have an insurance business part time. I also help with the health ministry at our church. And as someone who has experienced loss, this topic is near and dear to my heart. I lost my 7-month-old son, Ian Carter, in February of 2021. And so it has changed how we see a lot of things. And so I'm excited to bring people in so we can all discuss, talk, interact about this topic that is not very well discussed in our community sometimes. So, Dr. Olympia, when we get started, can you kind of just define the beginning, the infertility? What is that?
I appreciate that. So, infertility, just to get started off with, is the experience of an individual the experience of difficulty for an individual to naturally conceive within a 12-month time frame. And I say individual on purpose because both men and women can experience infertility. And depending on the age of the individuals, that time frame can shorten from 12 months to 6 months. So if you're over the age, I believe it's 34, 35, then the expectation is for you to conceive within 6 months. If you can't, then you're experiencing infertility.
Okay. When we look at the emotional toll of infertility, we deal with families and individuals outside of that birthing person. And some of that can be very stress inducing, or we just don't know how to say it or talk about it. What are some ways that we can navigate the society's pressures and the stigmas in our communities around infertility or childlessness?
So, societal stress and stigma, right? It seems like that rules everything. Let's go ahead and keep
Yeah, it does.
when we talk about societal stress and stigmas, it's really important to develop a sense of self. And sometimes that sense of self can be lost when you're experiencing a challenge like infertility or childlessness.
Say
So
it.
sometimes redefining what your definition of parenthood, motherhood, worth and value as a woman.
Oh, yes.
Sometimes redefining these definitions for ourselves can support us in operating in the outside world when we talk about the stigmas and expectations associated with others, right?
Okay.
Um, but so many other things that we can do attached to that, but I don't want to get ahead of myself.
Okay. So in defining self and our own expectations, how do we cope with the distress, knowing that we personally are struggling or our family unit is struggling with infertility? What are some ways that we can come to cope with those emotions? And is grief part of that set of emotions?
Yes. Oh my gosh. So when we're talking about someone who is experiencing infertility or who is navigating it, And I say this as a clinician, but also as someone who also has a infertility diagnosis, right? It's really important to you want to build and engage honestly with community, right? Oftentimes people get stuck in the mindset that they're suffering silently by themselves. You know, they have infertility, they're the only one experiencing
Mhm.
childlessness, and that can become really lonely and overwhelming,
Mhm.
you know.
Mhm.
So building community or identifying community and then engaging honestly with community is one of the number one things I tell people to do in order to cope with that experience. Um, Another thing I kind of encourage folks to do is take the time to really identify your needs, and your needs do include your boundaries, right? So take the time to identify these things, right?
Okay. Okay.
I know just considering my own experience when I was navigating, one of the things I dealt with was being triggered when I would go to the store and walk in that baby aisle, right? I knew my capacity, but I didn't think it was appropriate to everyone else's standard to be afraid to walk in that aisle, right? So I continue to re-traumatize myself unnecessarily, right?
Oh,
But when you take the time to identify your needs, um, and your capacity, you're then able to create and reinforce boundaries.
okay.
And
So how do we, oh, I'm so sorry. Go ahead.
you're fine. You're fine.
How do we determine what our capacity is?
Oh my goodness. So this is a large part of knowing self, right? Every
Okay.
woman's experience is going to be different. So
Mm-hmm.
there's some women where, hey, the baby owl may not be the problem for you. It may be the pregnancy announcements on social media. It may be the baby shower invitations or the birthday invitations for younger children. It
Okay.
may be, that one cousin who always just with ease is on child number 2, number 3, number 4, and you're having difficulty expressing that happiness because you haven't identified your own capacity, right? When you notice pause with these different life transitions and events, this may be telling you a little bit about yourself and the experience you're actively having. So if you notice pause, if you notice discomfort, is this a moment for growth? Or is this a moment to recollect yourself and say, okay, I'm feeling something here. What do I need in
Mhm.
order to move forward? It may be
Okay.
saying, okay, there's no need for me to go to that baby aisle to get that outfit for that baby shower. Hey, partner, can you do this for me? It may be something as simple as, hey, let's go on Amazon and very specifically look for a gift, order it, have it boxed already, because Amazon has wonderful skills like that,
They
and
do.
have it sent to this person's home versus me having to go and re-traumatize myself if I'm not yet at that space, right?
Okay.
So being
Okay.
honest about your needs, being honest about your limitations and your capacity so you can properly monitor your exposure and your engagement with these different experiences. And of course, allow yourself to slowly grow and go as time goes. When it first starts, you may not want to do the baby out, but maybe within a couple weeks or a couple months, it's going to be more comfortable for you. So, not forcing things.
Okay. Now, being the social worker that you are, I know you probably have some resources for people to look at and determine and research as they're coming to grips into getting to that part of knowing themselves. I know for me personally, that was therapy. And so I know that you probably could, if you would be so kind, tell us a little bit about some of the brief resources that are available for people who are struggling with infertility and where they can find that in this chat.
Okay. So when I think resources and infertility, I think coping, right? Or the ability to just kind of navigate. And even though there's so many different ways you can cope, we can, again, reinforce boundaries. We can develop community. We can monitor our capacity and what we have available, right? We can also create and engage in a self care regimen, which is so important. People forget that just because you can operate on autopilot doesn't mean you need to. Self
Okay.
care is a very intentional thing, but when we talk about some additional resources and therapy, right?
Hmm.
Infertility is not usually a short-term thing. When we talk about that diagnosis, that experience, that's usually
Yeah.
something that's more long-term. So I
Hmm.
tell folks therapy is something that can be beneficial to help you process the grief associated with the loss of a dream, the loss of
Mm.
the hope, a desire,
Yeah.
especially if you did achieve pregnancy and, experienced a loss, right? That these things can uh, be very overwhelming. And usually infertility doesn't come on its own. It's usually not unexplained, usually. Sometimes it can be, but we have things like hyperthyroidism, hypothyroidism, PCOS or polycystic ovarian syndrome, endometriosis, a lot of these different conditions that can result
Mm.
in infertility in women. So with these things, mental health oftentimes are aligned with it. Women can deal with anxiety, depression, body dysmorphia, a lot of these challenges.
Mhm.
So I encourage folks to seek out therapy because one, it's going to help you in redefining some of those things we talked about earlier, womanhood, parenthood, motherhood, what it means to be a woman. What
Mhm.
does family look like for you?
Right.
Being able to redefine those things. A licensed provider can help you and guide you in that grief while
Mhm.
also redefining those things. So there's some links that I included. One for Postpartum Support International. They have specialized therapists that specialize in the perinatal period that can help with navigating those things. So there's a directory that we're going to include in the chat where you guys can find a provider in your local area if you're
Okay.
interested. Um,
Okay.
I know with therapy also people immediately think money, right? And that makes
Yep.
sense because it can be expensive, especially if insurance doesn't cover it, right? Most insurances do, even state-based insurance. Most insurance covered therapy, but in the case it doesn't, you have some other access to resources like the Loveland Foundation. They
Okay.
offer um, they offer vouchers to pay for
Okay.
up to, I believe, 10 therapy sessions.
Okay. Okay.
Organizations like Cade Foundation that has some resources as well. And
Okay.
those will be in the chat.
And we're going to have all of that listed in our chat. Okay. All right. Thank you for sharing that. I do want to pivot a little bit because you mentioned loss. Can you define what loss is? Because people hear it, but they don't really know what all it entails. Can you define that for us, please?
So I think sometimes it's just kind of just the immediate thought that people have when they hear loss is a miscarriage, right? And though that is one form of loss, that's not exclusive or restrictive. Miscarriage is something that is tied to the first trimester, right? Or
Okay.
usually the first 16, 15 or so weeks of pregnancy. Then you have something called stillbirth, which clocks in for the remainder of pregnancy, right? And the reason those definitions are so different is because when we talk about stillbirth or the loss of a child in utero in the second or third trimesters, it's important for folks to know that that individual still has to deliver that child. They still have to go through the experience of delivering the placenta. They still may have those additional effects of milk coming in or
Mhm.
any birthing person who has achieved pregnancy will experience a fluctuation in hormones and chemical because of those different HCG, et cetera, that come up and then come down following the completion of the pregnancy, whatever that completion looks like. So it's important to differentiate between miscarriage, stillbirth, and then even child loss after a child has been born. A live birth has occurred. Sometimes you're going to have children that go to the NICU that do sadly do not make it, or even children that pass after going home.
Mm.
So loss covers any of those concepts.
That's a big concept. And with that, we've got a lot of questions. Okay. So one of the things I want to start off with is common myths. Some people may say or may think that the emotional response to loss in these three different definitions are all different. A different amount of emotional response, a different amount of grief. Can you speak on that? Is that true?
No, right? And what I will say instead is that because people are so different, right? People may
Yeah.
have different reactions to their experience, to loss, right? Um,
Mhm.
and there's not necessarily a difference that people have depending on what part, right? Because the moment an individual, right, finds out that a pregnancy has been achieved, there is a birth even in that process. There's a birth of a vision for that child. There's a
Mhm.
birth of hope, right?
Yes.
Plans for the future. Maybe the validation of a definition of family or parenthood or motherhood that has occurred. So, regardless of whether it's a miscarriage, a stillbirth, or a child loss following live birth, there is grief that occurs because whether we're grieving the loss of our hope, our plans, our intentions, right? Or whether we're grieving the literal loss of that individual, right? There's still grief that's occurring. And I
Mhm.
think it's really important even to consider that people grieve differently. So it may present differently, but that doesn't mean that grief isn't occurring.
Okay. Now, you just brought something up I want to talk about.
Okay.
Um, Grief presenting differently. Can we talk about um, men versus women? Looking at family member support of the birthing family as a whole. What um, is it a myth that men don't grieve the loss as significant as a woman? Is that true or not true?
I would definitely say that is Um,
Okay.
and we
Okay.
were talking about societal roles and expectations earlier, right? So
Right.
people usually have a preconceived notion about what grief looks like, right? Especially as it relates to those that identify as being women. They expect a more visceral response, a more emotional response. It's very external in comparison to when we talk about the experience or psychopathology that people assume for men, they expect or even silently require more of an internal experience. So, something that I've seen a lot with the couples I support is that my women or those identify as women are grieving externally, right? They're very verbal about their experience, right? Or they're verbal about the pain, the varying things that are going on, right? So they're grieving externally. And their male partners, on the other hand, or the males are grieving more internally. They may verbalize certain things, but it may not look the same, right? I remember having a pair of individuals and my birthing person, my mom, she said, I feel like he didn't care. I feel like it was just nothing to him and it changed my life, and um, being able to support her, but also save space for him to grieve in his experience, right? So I guess it's really important for both partners to know that you may be grieving and grieving differently or grieving at different times. Just because oftentimes I hear my men say, hey, I have to stay strong. I can't, I have to be strong for her. I have to be strong for our family. And of course, I'm speaking about heterosexual relationships, but we can also
Right.
look at those that identify in the LGBTQ realm, right?
Please.
The partner that may not have been the birthing person, I have to be strong for my partner. So
Right.
they may not show that visceral, emotional, or external grieving. They may be having more of an internal grieving experience.
I'm glad you mentioned that because the grief cycle has so many different stages, but everybody doesn't go into each stage for the same amount of time. And then, of course, you can zigzag. So
And I think it's really important, even when we talk about the 5 stages of grief, right? So, those 5 stages, you have denial, anger, bargaining, depression, and acceptance, right? And I think historically, one of the misconceptions that a lot of disciplines had was that this is a linear experience, and it's not. So you may step into grief and bounce around those 5 spaces and double tap,
Double
right?
tap. You said it, ma'am.
So
Double tap.
you may it's not a linear experience.
Mm-mm,
So someone
no.
grieving may, be in denial today, bargaining tomorrow, depression, anger, they may be at a period of acceptance and then go right back to denial, right?
Mhm. Right.
Because it's not linear and it is
Okay.
unique to a person. So, yeah.
Okay. Well, thank you for debunking some of those myths for me because we have a lot to talk about when it comes to partners, family members, and how to best surround this birthing person after a loss. What are some of your best suggestions, or how can we best support emotionally and physically for this person or this family?
And I want to cover that in 3 parts, right?
Okay, okay,
As it relates to the partner, right? How do you support your partner that may be going through this experience? Remain, allow space for a genuine experience, right?
okay,
That's for both folks. So you cannot hold the same standards of grief for your partner. So if you're
okay,
crying or you're, very verbal about your experience and things of that sort, you cannot hold that standard strictly for your partner because they may not grieve the same way. So save space for them to be able to grieve and navigate their emotions in an authentic way. Be willing to have the conversations and feel together. Um, and if you need external help, seek it, right? So if that means a provider, if that means that you guys are developing your own individual self-care regimens, and then maybe a couples regimen, right? Engage and care so you can begin the healing process. Because after grief, then comes healing. It's not something that always occurs at the same time. Sometimes, as extended family members, maybe your children have experienced this. Maybe your grandchildren or what have you. If you're a family member or a friend, please be wary um, of generalizations and be very wary also of attempting to minimize the experience by doing comparisons, right?
please tell
um,
them.
Listen, and I'm trying to say with the most professional manner, right? You want to make sure you don't make the mistake of telling someone, hey, for example, this is not a comforting statement. Well, at least you can have children. That's not a comforting statement.
Or I have another one. Just when are you going to try again?
Right.
Oh, don't.
Right. So
Mm-hmm.
you want to be careful to say things. You don't want to speak from sympathy. You want to speak from a place of empathy, right?
Okay.
Empathy requires us to be vulnerable with the other person, right?
Mhm.
So it's okay to say, I have no idea what you're going through if you've never navigated that path. It's okay to say
Please.
that, right?
Yes.
It's okay to say, I can't imagine what this looks like for you, but I'm saving space for you. What do you need from me?
Mm-hmm.
As extended family or as friends. Um, and also as extended family or friends, try to be careful with pressure, right? So some of those questions, just like what you said, when are you
Mm-hmm.
going to try again? Well, the first one sometimes doesn't work out. You can't make that person wait forever for a family, or bringing in additional communities or things that you guys may align with. So, oh, maybe it just God said it wasn't the right time because
Oh,
we people of color, right? So sometimes we do align spiritually or religiously, and that can encourage silent suffering with
yes. Yes, it does.
infertility or loss. So be
Right.
very careful of making these types of statements. Now, as professionals, basically all the additional things apply, but I would dare call to action as professionals. Make sure you take the time to get that additional information or that education, that continuing education, so you can
Yes.
support your clients. Not necessarily just the birthing person or just the person with the diagnosis, but even their partner. Kind of
Yeah.
being capable and able to provide that support or that psychoeducation, just that general stuff that they need to kind of move
Okay.
forward and make informed decisions, encourage options counseling or options.
Okay. All right. I am actually going to jump into the Q&A because I see a really good question that could follow this. And this is from Jasmine, and she asks many questions, but what suggestions to cope with negative experiences with medical professionals that are not empathetic with my fertility or pregnancy journey?
Mm. Jasmine, I appreciate you for asking that.
Yeah.
Um, when we talk about coping, you want to give yourself permission first to feel exactly what you feel. So if that first response is anger, frustration, confusion, give yourself permission to feel whatever initially comes up for you, right? And then ask yourself the question of, is this person acting out of harm or out of ignorance?
Ooh,
Right? I know, I went there, it's okay, we gonna keep going. So, is this person acting out of harm or ignorance? Because if they're acting out of ignorance, what can remedy that is education, right?
right,
And
right,
this is not putting the responsibility on you to educate medical
right.
staffs, right? But
Yes,
it allows you to cope in a way where this is no longer, uh, targeted at me. This is something that they don't know. So I'm not suffering silently, right? Um,
right.
so in encouraging coping, just allow yourself to ask yourself that question, right? Because usually when you do and you identify, oh wow, this may really be ignorance. Now, for some, could it be
Yes,
intentional? Oh,
yes.
absolutely. And if that's the case, I would encourage you to seek advocacy and support with a professional like myself, or a patient advocate, right? But
Right.
uh, allow grace, because once you allow that grace, you're going to respond to it differently, and you're going to be able to engage in coping more intentionally. So,
Okay.
is it coming from a place of harm or from ignorance? If it's coming from ignorance, it can be remedied by education. It's now no longer you that it's being targeted towards. So now you can engage in coping,
Okay.
and your feelings will be a little different attached.
Okay. I am actually looking because we have someone who's in the chat and they're the director of patient engagement.
Okay.
So if we had to come up with a suggestion, a protocol, when experiencing a loss at the hospital or at the doctor's appointment, what are give me your top two things that you would make sure that this patient engagement advocate has ready for families and birthing people in the event of a loss in a clinical setting.
So I will say, just from my experience, that when we talk about later pregnancies, so pregnancies within the definitely third trimester, or even experiencing loss at a stillbirth, or even following a live birth, so a NICU loss, something that occurs in that way, I will say that most hospitals, facilities, they have it squared away. Most do. I'm
Okay.
going to give it that. They usually resources available, they have staff available, they have a certain protocol that they go about to support the birthing person and partner in spending that time with the child and being able to take those moments before moving forward in loss, right? But I will say I've seen a gap for folks
Mhm.
that experience miscarriage, right?
Ooh, okay.
I've had clients that, kind of let me know what I was told was, "Oh, I don't hear a heartbeat." And that was their, um, that was them being informed that a loss
Mhm.
occurred, or hey, you had a miscarriage, so would you like to do a DNC, or would you like moving immediately to
Right.
next step options without giving that individual or that couple the opportunity to process what they've been informed. So I would
Mhm.
say the first step is making sure we're encouraging medical personnel, um, that bedside manner, right? This person is about to receive some of the toughest news. Uh, they're about to receive some tough news, whether it's a diagnosis like infertility, or whether it's, hey, I'm sorry, this pregnancy is not going to come to fruition in the way that we all hoped. So it's very important to use the language that the client is using, I would say, right?
Okay.
So if the client is describing their experience as my baby passed, right? Respect that. Now, is it important to use the word death? The first time, yes, right?
Okay.
But if after you've let them know that a death has occurred, this pregnancy is not viable, you use your clinical terms, you've identified that there has been a death, right? If they move forward in saying that my baby has passed, respect that chosen language. Yes,
Right.
the child has passed, right? And give them a few minutes to process, right? Um,
Okay.
Consider, if you don't already, having a mental health provider available on call, or even contracted with, or even just a specialist that you can refer your clients to,
Okay.
right? And I say that because oftentimes, we're still talking about the postpartum period, whether a woman experiences a miscarriage, a stillbirth, or a child loss later on after birth, after a live birth. So you want to make sure they know that they have access to mental health resources in the case any perinatal mood and anxiety disorders come up.
Okay.
And always, always assess any birthing person for safety and postpartum depression and anxiety. Always.
Always.
Please don't be very mindful of addressing things like perception and bias with providers, providing that education. Because sometimes, if someone doesn't have the perception that a person is at that point in pregnancy where they might experience postpartum, they may neglect to do the appropriate assessments, and you could be dealing with a dangerous situation. So, just making sure you're doing
Okay. I do want to say that that is so crucial um, to me. How about that? I'm just going to say that's crucial to me. All right. Um, one of okay, so you have gotten a lot of information for us when it comes to infertility, but also loss. I do kind of want to touch a little bit on the um, emotions around infertility treatments, and because you were mentioning the emotions, and that I have only heard can make things a little difficult as well. And we kind of didn't talk about infertility treatments and the mental health around that. Can you dive into that for a little bit?
Yes. Okay. So, generally speaking, infertility treatments, we're usually talking about art or assistive reproductive technology, or some, more, I don't say lower level treatments in a tier system, but more so like what's appropriate, what'll, the lowest amount of medication and intervention medically and going up, right? So,
Okay.
when we talk about these type of experiences, whether it's medicated cycles, whether it's time conception, IVF, IUI, what have you, um, mental health still plays a part, right? But
Right.
we're talking about anxiety, talking about depression. If that, that egg retrieval doesn't work, we're talking about um, shame, right?
Mm,
And when we look at the Black and Brown community, for some reason, we are hypersexualized. And, we're assumed that we
mm,
have this hyper fertility, right? So you
right.
have birthing people that are experiencing, trying to navigate these things, with those things on their shoulder. I should be able to have, I don't know about you, but when I was growing up, my mama told me to be careful about kissing somebody because I was going to get pregnant. Okay. So it wasn't, we weren't really encouraged to consider, oh, wow, there may be a challenge around it.
Right, right.
You have a birthing person that is actively conflicted internally just with the reality she's experiencing and
Mhm.
what she's been taught. Okay.
Right.
So you really want to make sure to consider the anxiety, the depression, the shame that might be associated, sometimes the embarrassment, depending on different communities or spaces that person might occupy, right?
Okay. Okay. Yeah.
And with these different experiences, mental health or a mental health provider can provide some support there, right?
Right. Right.
Um, Maintaining baseline healthy, right? Reducing those cortisol levels can from it's statistically proven that that can kind of help a little bit with the process. So if you're experiencing or considering fertility treatment, it may be a good thing to dial in with a provider or actively use your self care regimen. And please let me take some time to define self care
Yes,
because people
please.
hear it, right? And I've
Yes.
had folks tell me, well, I get my nails done, I get my hair done.
It's
Um, I
please
go
define
to
it for us.
the spa. I, take that trip once a year, and I have to let them know that these activities, though they are considered self-care, it's not exclusively self-care. That's maintenance care. Anything we can't afford to do on a consistent basis, right? Right? I can't listen. Dr. O is not going to get nails done every week. You know what I'm saying? That sounds like a lot. Something we can't do consistently is more maintenance care. When we talk about
Right.
self-care, it's an umbrella. It is the
Right.
intentional efforts that we are making on a routine basis to maintain wellness in all aspects, right?
Yes.
So you having your tea, if that's what appeases you and what supports your physical, mental, spiritual health on a daily basis, that is a self-care regimen. You taking the time to drink your water, go to the gym, watch that funny movie when you're in between the week, working out, visiting with friends, family, these different things, dancing, uh,
Journaling.
the journaling, all these different things can be considered self-care. So self-care is a combination of behaviors, behavioral
Okay.
activation activities, hobbies, right?
Okay.
And
Okay.
skills that
Say
we
that one more time.
so behavioral activation activities or hobbies, aka hobbies,
Okay.
right? Coping skills or even the day-to-day things that we do to take care of ourselves are
Okay.
self-care measures that can be a part of a self-care regimen.
Okay. Okay. Thank you for pointing that out. I am so glad that you differentiated between maintenance and self-care. I wasn't really aware of that. Thank you.
Yes,
Um,
we have a lot of folks that, they do have that assumption, and
yeah.
what you don't want, whether we're talking about your patients, right? Because you're in the medical space, your family member, your partner, or even yourself to engage in something that's going to be so um, emotionally fueling, like
Yes.
fertility treatments, without a good self-care regimen.
Okay.
So I usually say that's a part of the workup plan. How
There
do
you
we
go.
manage stress?
Yes. Yes. All right. So I want to talk to our audience that's live with us and give them a chance to, in the chat, talk about any rituals, any practices that help them honor any of their losses, whether that is infertility or infant loss. So I will keep my eyes on the chat, but
Can I talk a little bit about that?
I
I'd
would
love.
love that, please.
So usually when a loss has been experienced, whether we're talking about again that loss of hope, perspective, the plan, the dream, or whether we're talking about the loss of a person, one of the things I encourage as a therapist is for there to be a way. that we honor um, what we've lost. That we take the time to honor that and save space for that, right? Especially when we talk about child loss.
Mm.
Um, I've noticed that when I do that with my clients, when they get that opportunity to honor in a way that's for them,
Okay,
the grieving process goes so much easier, so much smoother. And when I say easier and smoother, that's not to say that we're not
right.
experiencing those heavy emotions, but it's to say that there's something that they're able to now take control of,
Oh, there you go.
on
Okay.
something that they could control in any way, right? I've had couples and individuals honor their children in so many different ways that I again say it's really what works for you. I've had couples that decide to do an annual candlelit, memorial. I have couples that decide to open a scholarship in the child's name. I've had couples or individuals decide that they want to do a Viking send off because that's what aligned with them. So I encourage any birthing person or partner that has experienced a loss to consider ways to honor your loss that
Mm.
is most true and authentic to you.
Okay. I want to share mine. So every year that we have a birthday for my son Ian Carter, um, we we historically try to do a trip the first year, the second year. Thankfully, we were in a pregnancy, so it was high risk, so we decided to stay put. But we do a small weekend getaway, and we talk about how old he would have been, or we would have been pushing him on the swings and at that park. And so we kind of just take this trip as he was with us. Um, and that has been really um, good because I think for some people, it is easier to stay silent than to mention or remind, especially if it was a stillborn, the name of that child. So I think saying the child's name has been crucial for me instead of saying, oh, we had a stillborn. No, we had a son named Ian Carter. Um, so in my experiences also with the miscarriage, we gave that child a name. And so we kind of keep that one a little bit more private. But his name was Devin. We don't know if it was girl or boy, but we chose something kind of, uh, unisex. But I think we honor that by giving them their names and saying their names. So that's my personal experience.
I truly
Um,
appreciate you sharing that. And that's something I would say, again, just being respectful of the language that the individual is using. So if they're
mhm,
using the name of the child, use the name of the child,
mhm,
regardless of gestational age. Use the
right. Yeah. All right. So um, I see a lot of people saying, yes, calling the baby by their names. Yes, I see that as well. Okay. So this time I would like to open it for any questions or any concerns that anyone wants to mention. There was a question about, but it really, I don't know. I'm just going to put the question out there. Is there any current research regarding uterine fibroids and how they impact fertility? That's outside of my wheelhouse, but I did want to put that out there just in case there are some healthcare professionals here that have some resources that they can drop in the chat for answering that question.
I can
Um,
I can briefly touch that.
you
There's
can, please do.
quite a bit of research regarding
Oh, I did not
uterine
know that.
fibroids, so I would encourage you to look into it. For
Okay.
those that may not have access to scholarly journals, you can use something like Google Scholar online to get access to some of those articles. And of course, if you do have access to those journals, definitely look into it. There's quite a bit of research that talks about it. And yeah, I'm looking at the question now, so I was just making sure I didn't
Okay.
miss parts of that. But yes, there is research that talks about uterine fibroids, cysts, things of that sort, and how they can influence or impact infertility.
Okay. Is there anything that we didn't touch on that you want to bring up that is important when we look at the
That's all right. I am quite sure there was an emergency or something that occurred.
okay,
Yeah.
okay, sorry about that. Um, is there anything that you want to add that we have not touched that's important to understand when it comes to the emotional toll of loss?
Options. I know that sounds interesting, but when I talked about making sure we talk about options earlier, there's so many options attached to either one of these process, infertility or loss or childlessness. So considering the different options that are available to a person outside of assisted reproductive technology, if that's not something they're interested in, right? Being able to explain those options or even refer them to a professional that is knowledgeable of them so they can make an informed decision, right? Um, for Black and Brown folks, just considering what some of the barriers to an experience like that are, right? Finance is one of the number one barriers outside of stigma, right? When Black women suffer from infertility at 2 times the rate than their white counterparts. And I think that's a very big statistic that folks miss um, when we consider how impactful this is within our communities. So, really, just paying attention to some of those barriers. I do see a question here. What if I want to honor and commemorate the pregnancies we've lost, but my partner just wants to find peace and move forward? Um, Beautiful question. And this is why I encourage both honoring and commemorating in a way that's individual and partnered if the desire is shared, right? Because we want people to operate in an authentic way. So we don't want to force a part of the process that we may be prepared for because we've navigated some levels of grief and healing in comparison to our part who may not have, right? Uh, Forcing or encouraging them to operate in something that they don't presently stand in may do more harm than good. So allowing
Okay,
the conversation to be a safe space of, hey, I really want to do this and I really want to know your thought. I really want you to do it with me, but I want to know your thoughts. Is this something that you also want to do or do you have other thoughts? Right? Allowing
okay,
it to be a conversation because their way of finding peace and moving forward may
mhm,
actually be honoring and commemorating just privately, right? I
okay,
had a gentleman who um, he liked playing video games. He commemorated the child in a way where he created the child in the game, using the name, using the things that he had dreamed up for the child. So that was his way of honoring and commemorating. So I encourage, long story short, I encourage couples to determine ways individually and
okay,
also together if it's a shared desire.
okay, okay. That was a very beautiful question. Thank you for answering that. All right. Um, with that being known, we just have a few more moments. I know you mentioned you had a lot of resources you were going to put in the chat. I do want to make sure that we have some of those. There they are. Okay. All right. Well, thank you so much for your time. Thank you for your experience and sharing your knowledge. I had a wonderful time getting to know you. And yeah, thank you for everything.
Absolutely. Thank you to everybody that jumped on to talk about this topic. It's something we don't really talk about in the Black community. So
Mhm.
to see it talked about, to see it being given the attention, so
Yes,
find some healing and some community in this was beautiful. Thank you so much.
yes,
I'll
yes.
stay on if there's any additional questions.
Okay. All right.
And I do want to, of course, call to action, right? If I do have any mental health or medical professionals, if you are interested in having some continuing education, talking about more ways to get this information to your clients or to your staff, feel free to reach out.
Okay.
Uh, Oh, someone asked about the CADE Foundation. Yeah, so CADE actually has a lot of information and resources as it relates to uh, financial support for fertility treatments.
Okay.
About that being one of those tough things that folks, experience with infertility. So I can find that link and drop it in the chat for sure.
Okay. Thank you very much. All right. Well, this has been great. There it is. Okay. Cade Foundation. Okay, we've got that. Perfect.
Beautiful, beautiful. All right. Looks like everyone's questions has been answered. So I'm going to go ahead and give Dave back. I'll stay online for sure. I appreciate everyone being here.
All right. Me too. Take care.